Dr. Jordan Peterson is someone whom I really admire. I found his book, The 12 Rules for Life, were very helpful for me when I was navigating a period in my life that was particularly difficult. I generally like what he has to say about psychological and philosophical issues, but when it comes to his knowledge in nutrition, it's pretty thin. In fact, it's outright wrong. He's made the disparaging comment that vegans are clueless.
How many vegans do you know? They're clueless. They're clueless.
Really? You're going to mispronounce the name of the group that you're going to disparage? Right there, you know he doesn't know what he's talking about. I think it makes much more sense to take the advice of doctors like Dr. T. Colin Campbell, PhD, Professor Emeritus of Nutritional Biochemistry from Cornell University, Dr. Caldwell Esselstyn, who directed a trial in heart disease and nutrition at the Cleveland Clinic, and Dr. Dean Ornish, who also directed a trial in heart disease and nutrition and has been described as the father of lifestyle medicine. Let me remind Dr. Peterson of Rule 9 of the 12 Rules for Life. Assume that the person you are listening to might know something that you don't. Now, remember, adhere to this rule. Maybe you're going to learn something. My understanding is that Dr. Peterson adheres to a carnivore diet. He eats nothing but meat and green vegetables. And by doing so, he actually improved his health. He lost over 50 pounds and started to feel better. You cannot jump to the conclusion that that means that meat is a necessary component of the diet or that's even beneficial. All you can say is that the change produced some favorable outcomes for Dr. Peterson. The likely thing, if he was eating a typical Western diet, which he probably was if he was overweight, is that getting rid of white flour and sugar and processed oil and junk food is good for you, and that eating green vegetables is also good for you. You can't say that it's the presence of meat that made him healthy. And there's a lot of good evidence, tons of good evidence, that eating meat, particularly red meat, is in fact detrimental to your health. It may be detrimental to your health, but he produced a net gain, but it doesn't mean that meat, therefore, is critical for good health. Now, people make arguments like human beings have been eating meat forever. The truth is, the early humans were probably pure herbivores. And as they started to expand their range, when they had the opportunity, they would maybe scavenge a corpse. And as time went on, they started to hunt and would eat meat when they could. That doesn't mean that it's optimal for human health. The challenge back in those days was to live to the next day and hopefully reproduce. It wasn't about having an optimal physiology to live to be 100 or 110 years old and in good health for most of that time. If you look at the blue zones, these are a number of regions throughout the world in which people are noted to live particularly long and healthy lives. The prototypical blue zone is Okinawa. Okinawa has had more people living to 110 years of age or older than anywhere else in the world, even though it is a tiny speck of the human population. These people lived long, robust lives, and they ate almost nothing but plant food. Their animal food intake was trivial, in the order of the equivalent of half an egg a day worth of animal protein. The rest of their calories came from unprocessed plant foods, and most of their calories came from sweet potatoes. They ate a very, very high carbohydrate diet. 80% of their calories came from carbohydrates. Carbohydrates, don't they make you fat? Don't they make you diabetic? According to Dr. Peterson, it's carbohydrates that have been a scourge causing the rampant poor health that we now experience in Western civilization. It's simply not true. But Dr. Peterson is not recognizing that there's a big difference in carbohydrates. Jelly beans and kidney beans are completely different, and your body handles these things in completely different ways. If you eat a lot of unprocessed carbohydrates, you're going to promote good health. You eat a lot of processed carbohydrates, which is most of what people eat, you're going to have poor health. The Adventist 2 study is very interesting. The Seventh-day Adventists believe that the body is the temple of the soul, and it's their responsibility to take care of their health. They're quite a uniform population. Socioeconomically, they tend to be fit, they don't smoke. But within the Seventh-day Adventists, there's a different dietary patterns. All of them are considered generally healthy, but they eat varying amounts of animal products. You have omnivores, you have semi-vegetarians, you have vegetarians, you have pescatarians, and you have vegans. Only the vegans have a normal body mass index. All of the other dietary patterns that include animal products were overweight. And the difference was not trivial. It's really a lot. Between the omnivorous women and those eating a vegan diet, the weight difference is almost 40 pounds. That's huge. And if you're looking for a manner of eating that's going to promote weight loss and a lean, healthy body, you can't deny that. The likelihood that you're going to have a lean body habit while eating meat is actually really low. The Epic Panacea study in Europe, which is a big study, has corroborated that evidence. The lowest rates of diabetes amongst the different dietary patterns of the Seventh-day Adventists was with the vegans. In fact, they had about 74% less risk of type 2 diabetes. Type 2 diabetes is a big deal. 11.3% of the US population is now type 2 diabetic. About 3 times that many have prediabetes, whether they know it or not. And these numbers are relentlessly increasing. So if you've got a dietary pattern that can stave off the risk for type 2 diabetes, you got to pay attention to it. Now, all animal foods promote weight gain. It doesn't matter what type of animal foods you talk about. For some reason, chicken is the worst. Animal protein promotes insulin resistance, as does saturated fat. What's the main source of saturated fat in the human diet? It's meat. You do get a little bit of saturated fat from eating nuts, but it's not that much. Now, the relationships between dietary cholesterol, serum cholesterol, and saturated fat and heart disease is actually really quite well worked out. The more cholesterol you eat, the higher serum cholesterol tends to be. Although they do, as you eat more cholesterol, your cholesterol will go up. It'll start to actually flatten out. The bigger influence on your serum cholesterol level is actually saturated fat. The more saturated fat you take in, the higher your serum cholesterol and the higher your risk of heart disease. The relationship between serum cholesterol and heart disease is really quite well established. Dr. William Castelli, long-term director of the long-running Framingham Heart Study, has made the comment that he never saw a heart attack in someone with a cholesterol less than 150. That's quite a bit lower than the average United States. How do you get a cholesterol less than 150? Well, vegans on average have a cholesterol that runs around 140. They tend to have LDL cholesterol less than 70. In those ranges, the likelihood of having a heart attack is very low, and you'll be very close to heart attack proof. With heart disease being the number one killer, this is something we need to take note of as far as preventing heart disease. Both Dr. Dean Ornish and Dr. Esselstyn ran trials on the relationship between diet and heart disease. The Ornish trial was manipulated more variables than the Esselstyn trial. Dr. Dean Ornish incorporated things like stress management and exercise, where the Esselstyn trial was more of a pure trial in that there was one variable change, and that was the diet that they're eating. In the Esselstyn trial, they ate a very, very strict plant-based diet with no animal foods, no white sugar, no white flour, and no processed oils. And in fact, they weren't even allowed to eat nuts because nuts do have a little bit of saturated fat, which might promote heart disease. Now, interestingly, other studies have shown a bit of a decreased risk of heart disease when you consume a small amount of nuts. Something to be aware of with nuts is they're very calorically dense. I think if you don't have established heart disease, it's a good idea to include nuts in your diet. At this point, if you do have established symptomatic heart disease, I think it's important to follow the Esselstyn trial because that's the only method that's been shown to reverse heart disease. But for those of you that don't have established heart disease, a small handful of nuts every day is a good idea. And actually, people that eat a little bit of nuts tend to have lower body weight for reasons that are not entirely clear. But nuts are very high in calories, so they're very calorically dense. So I'd recommend go easy on it if you don't actually want to start gaining weight. Now, in the Esselstyn trial, it was interesting. Within a couple of weeks of adopting the diet, these people's chest pain was starting to go away because a plant-based diet is so phenomenal at improving blood flow. Animal foods do the opposite. Within a few hours of eating an animal-based meal, your blood flow is actually clamping down. You eat a plant-based meal, particularly if it's got green vegetables in it, you're improving blood flow. The green vegetables facilitate the production of a gas called nitric oxide that opens up your blood vessels. And it was really interesting, unexpected finding with the Esselstyn study was that the men, within 2 or 3 weeks of starting this trial, were starting to get morning erections because the blood flow was being improved so much. Why would that be? You're not going to get rid of the hard plaque, the established plaque, within 2 or 3 weeks. Well, what it was doing is improving collateral flow, the flow in the blood vessels around the blockages. If you are a middle-aged man and develop impotence, it's a harbinger that within the next couple of years you're going to have symptomatic heart disease. The penile artery is about a quarter of the diameter of the coronary arteries. So it can become symptomatic first with impotence before you actually develop coronary artery disease that's symptomatic. Several of Dr. Esselstyn's patients had coronary angiograms done. A coronary angiogram is a procedure in which a thin catheter is threaded up from either the arm or the groin into the origin of the coronary arteries in the heart. X-ray dye is injected and real-time X-rays are taken to show the presence or absence of blood vessel narrowing. What their angiogram showed is that they had, at the very least, arrested the progression of plaque and in some cases actually reversed it. It was really quite amazing. And up until the time of the trials with Dr. Ornish and Dr. Esselstyn, it had been thought that atherosclerotic plaque was something that was not reversible. We now have long-term data on the Esselstyn trial. And what it has shown is that the event rate, i.e. the rate at which people have heart attacks or strokes or death, in the intervention group, the group that was given the whole plant-based diet, is 1/100th of the control group in which they were just given sort of standard dietary advice. In fact, the individual that had a cardiac event was not actually sticking to the diet. So you can't really say, in fact, that it was a failing of the diet. 1/100th rate is astonishing, given that the Esselstyn trial has shown that heart disease can be arrested and reversed, and that given that coronary artery disease is number one cause of death, with 40% of all people dying, right there, you've made the case for a whole food plant-based diet. There's tons more information and data about the benefits of whole plant-based diet, but right there, Dr. Peterson, I've won the argument. Trimethylamine and trimethylamine oxide are really interesting, and these are mechanistically associated with atherosclerotic plaque in general. When you eat meat which has carnitine in it, or eggs which has choline in it, in the gut, through gut bacteria, those compounds are converted into trimethylamine. And then they travel through the portal circulation of the liver and oxidize into trimethylamine oxide. TMA and TMA promote the development of plaque. Interestingly, if you get a vegan, in the interest of science, to start eating steak, initially they will not produce TMA and TMAO because they don't have the harmful bacteria that make that conversion. If they keep eating meat on a regular basis, they will start to produce TMA and TMAO and put themselves into a state that's favorable for the development of atherosclerotic plaque. People that eat meat, it's been established, have less favorable body odor than people that eat a pure plant-based diet. There is an interesting condition called trimethylaminuria, in which these people have a genetic difficulty metabolizing a TMA. And so they smell bad no matter how much they shower. What's the treatment for a trimethylaminuria? It's to go on a plant-based diet. So if you want to minimize your risk for cardiovascular disease, you need to minimize your intake of cholesterol, saturated fat, choline, and carnitine. That's just the way it is. Sorry, Dr. Peterson, but that does not fit with the carnivore diet. Now, just by chance, I started reading this amazing book, Plant-Powered Protein, by Brenda Davis, Corey Davis, and Vicente Molina. The premise of the book is that a reasonably structured plant-based diet, you can get all the protein that you need. Now, in one part of the book, they talk about the associations between animal protein and disease conditions. They have a summary of 27 different studies. These are large studies. And there's just some absolutely fascinating data here. I'll just give you a sampler of some of the information. A study with over 416,000 participants showed a drop in overall mortality when 3% of calories from animal protein was replaced with plant protein. 10%, a 10% drop in mortality by replacing 3% of calories from animal protein with plant foods. The drop in mortality when 3% of calories from dairy products was replaced with plant protein was 8%. The drop in mortality when 3% of calories from red meat was replaced with plant protein was 13% for men and 15% for women. And there was a drop in mortality when 3% of calories from egg protein was replaced with plant protein. That was 2% for men and 21% for women. There's a lot of data here with very large trials. Other trials with over 200,000 people. So this is not to be dismissed. There was a study with over 6,000 people that showed that the increase in type 2 diabetes mortality in people when people aged 50 to 65 with a high protein intake, animal protein intake, comprising 20% or more calories, was 393%, almost 4 times as high. The increase in type 2 diabetes mortality in people aged 66 or older with high protein intake, 20% or more calories, was 1,064%, more than 10 times the risk of dying from type 2 diabetes. These are staggering statistics, and it's not like it's just a few straggler studies that show this association. There's 27 studies that they reviewed here, connecting animal protein intake with reduced health and mortality. Dr. Peterson really undermines his credibility on all matters when he gives his off-the-cuff dismissal of a vegan diet without knowing what he's talking about. It makes me question the things that he states on other matters as well. I've only gotten started on the case against meat. Stay tuned for part 2.